When we think of severe illness, we usually look for physical alarms. We look for decay, a failing body, something we can measure with a glance. But some crises hide behind a pristine surface, fracturing from the inside out. That is the paradox of bulimia nervosa. A person can be suffering from a life-threatening psychiatric illness while maintaining a perfectly normal weight. Society often writes off eating disorders as an extreme form of vanity or a simple obsession with body image. The reality operates much deeper. Beneath the surface, this illness is driven by intense shame, crippling anxiety, and a brutal internal dialogue of self-criticism. Because bulimia hides in plain sight, we have to look past the physical scale. In order to truly understand the disease, we need to examine the invisible psychological engine that keeps it running. This diagram shows how bulimia actually functions. It operates as an active, mechanical behavioral loop. Here at the starting point, a trigger or a spike in anxiety sets the mechanism into motion. The anxiety pushes the cycle into its first major action, the binge. This episode is characterized by a terrifying feeling of being completely out of control, consuming large amounts of food rapidly. To counter that loss of control, the brain demands an immediate undo. This drives desperate, shame-fueled compensatory behaviors to regain a sense of order, like vomiting, relying on laxatives, fasting, or engaging in compulsive exercise. That forced restriction leads to a crushing emotional crash. The resulting shame and guilt feed directly back into the initial anxiety, permanently restarting the engine. This relentless cycle is the illness, a brain mechanically trapped in a loop. While the loop operates internally, the friction of the cycle generates a trail through a person's behavior and physical health. You might notice abrupt trips to the bathroom immediately following meals, or an obsessive secrecy surrounding food and eating habits. Physically, the repeated trauma of the cycle manifests as dental erosion caused by stomach acid, along with distinctly swollen cheeks. Recognizing these specific leaks in the system is vital because the outward appearance of a normal body weight otherwise masks the severity of the crisis. Brain loops, no matter how deeply entrenched they seem, can be rewired. It starts with an accurate diagnosis from a licensed clinician. We have specific circuit breakers designed for this. Enhanced cognitive behavioral therapy, or CBTE, and interpersonal therapy actively intersect the cycle. These clinical treatments boast strong evidence precisely because they are engineered to target and dismantle the exact nodes of that psychological loop. They interrupt the binge and compensate mechanism and address the underlying anxiety directly. Bulimia is a mechanical system that can be systematically dismantled with the right clinical tools to achieve genuine recovery. Patients can access these specific circuit-breaking therapies through coping and healing counseling, an eating disorder-informed practice. They offer a diverse, culturally competent team of over 15 licensed therapists, including clinical social workers, professional counselors, and marriage and family therapists. This map shows their 100% HIPAA-compliant telehealth model, which is available across all 159 Georgia counties. Next to it, this data chart details the cost metrics for treatment. Financial barriers are heavily reduced. Medicaid patients have a $0 copay, while sessions with major insurances like Aetna, Cigna, Blue Cross Blue Shield, United Healthcare, and Humana range from $10 to $40. By removing geographical and financial barriers through statewide telehealth, the power to step out of the loop and heal is in your hands. Visit chctherapy.com or call 404-832-0102 to begin.